I can't cut back on food or rent.
If you always take medication, then you have to pay each time you get a script.
Couldn't do it, I just wouldn't go to the doctor.
A healthcare system on the brink.
Medicare is on its last legs. It is failing because a lack of investment. That means the pipeline of new GPs coming through is smashed. That situation has been allowed to dwindle.
A new poll out today showing a fifth of Aussies say their GP has stopped bulk billing. More than 70% of us seeing our medical expenses skyrocket in the past year.
Fewer doctors are bulk billing. This is a very complex problem though. You know, it's costing doctors more to run practices. It's costing people more to go to the doctor.
State and territory leaders will this week pressure the federal government for a Medicare funding overhaul. Right now, the states bear the brunt of an ailing system with people who can't afford a GP clogging hospital emergency departments, which are state funded.
More people are going to emergency for issues which really can be dealt with by a local doctor or a clinic. And this is a bit of a wicked problem, this one, because there's no simple fix.
When you go straight to hospital, it's going to be a burden for the society, for the community.
If people have to pay, especially around here, that would just get worse. People won't get treatment.
Last year, for the first time, out-of-pocket costs outweighed the Medicare rebate. But experts say raising the rebate won't solve the whole problem.
We need to address the financing part. The other thing we need to address is the actual system and the funding model and the way in which we deal with people who've got multiple chronic and complex care needs.
That includes the need for more multidisciplinary care clinics with services like GPs, heart and kidney doctors and podiatrists all in the one location.
Because it's coordinated, or at least there's good communication between the people, it means that you don't drop between the cracks of care.
At the end of the day, our real challenge is to strengthen Medicare again after 10 years of cuts and neglect.
So is Medicare still fit for purpose, and can it be fixed before it flatlines?
Dr. Danielle McMullen is the Vice President of the Australian Medical Association and joins us now. Danielle, people at home would be watching this, seeing that their own medical bills are going up and asking, why are doctors crying poor?
Look, Medicare is now 40 years old, but in that time very little has changed in the structure of Medicare, and we've also seen successive governments fail to index that patient rebate appropriately. So we're finding that the costs of providing that comprehensive care that you want and deserve from your GP continues to skyrocket with the cost of living, and yet that rebate back in your pocket as a patient hasn't kept pace with that. So patients are facing increasing out-of-pocket costs in a system that really isn't built for the chronic disease that we're all living with today.
Is there a world in which bulk billing could be scrapped altogether, do you think?
We're certainly seeing bulk billing rates fall at their most rapid rate around the country, and that really reflects how that rebate back to patients just hasn't kept pace with the cost of providing care, which is now double that patient rebate. So we just can't afford to keep bulk billing and keep the doors open. But having said that, GPs do want to be there, particularly for our most vulnerable patients, and we want to make our care accessible and affordable. We just need government support to do so, to recognise that general practice is still the most efficient part of our healthcare system, but has been so under-resourced for so many years that it's going to take a fair bit of catching up.
Doctor, forgive me if this is a stupid question, but why is that amount that you get from the government for those services not enough for you to run your businesses?
So running a general practice actually has fairly high overheads. Running the numbers on it, it actually just isn't enough. That $39 or so for the 15-minute consultation. Often doctors may see 3 or 4 patients per hour on that rate, and it simply isn't enough to keep the system rolling, keep your doors open and still earn enough of a take-home wage to be able to look after your family and stay afloat in running your business. Particularly difficult, though, is seeing patients who need that longer consultation, because the rebate back for patients who spend 30, 40, 50 minutes with their doctor is markedly lower than those who spend 5 or 10 minutes with the GP. And that's another area where we want the government to really focus, is on those longer consultations for patients with complex illness who need to spend more time with their doctor, making sure they get an appropriate rebate back.
All right, Dr. Danielle McMullen, thanks so much for chatting with us tonight.
Thanks for having me.
I think central to all of this, as with so many things in our country, is that part of the health system is managed by the Commonwealth, part of it by the states, right? So the hospitals, are the state's responsibility, the GPs and Medicare fall under the Commonwealth's responsibility. And we all have these experiences where you see the different parts of the system not working together as it should. But I think we can probably all think of examples of where we kind of have to go and get a GP referral or an update on a prescription that probably doesn't need a 15-minute appointment. And obviously the GPs make a fair point about funding and investment in their part of the system. But clearly, given our ageing population, the shortage of doctors generally, there's going to have to be compromise somewhere in order for this system to kind of stay afloat.
Yeah, no, it's getting really serious at that. My parents are both doctors and they've had to make some changes recently. They've started charging me every time I go home, which is brutal, you know? No more free meals, Mum and Dad, anyway.